Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Dr. Jasen Gundersen, CEO and co-founder of CardioOne, a company revolutionizing how independent cardiology practices operate and thrive. Jasen brings a unique perspective as both a practicing physician and a healthcare innovator, having spent nearly a decade in clinical practice at UMass Memorial Medical Center before transitioning into healthcare leadership. He has been recognized as one of the 50 under 50 influential leaders and held executive positions at major healthcare companies, including Team Health and CareCentrix. Through CardioOne, he is on a mission to preserve physician independence while preparing practices for the future of value-based care. His journey from bedside to boardroom offers invaluable insights into intersection of clinical excellence and healthcare innovation. Welcome to Health Tech Heroes, Jasen.
Thanks for having me.
It's such a pleasure having you here, Jasen, and I'm really looking forward to your journey and your advice and your perspective on healthcare and health tech, and thank you for being here. You spent nearly a decade as a practicing physician before becoming an entrepreneur. When did you realize you needed to step away from patient care to fixed healthcare from the outside?
I think I was an accidental entrepreneur. So my story began, I was at UMass, I was an academic doc and fairly new grad, and one of the chairs of the department came to me and said, "Hey, can you build a hospitalist program for me? We need one for the department and the other one isn't running as well." So I hadn't gone to business school, so I called my friends and figured out how to get a revenue projection and a P&L statement, and I launched my first program with 4 of us. There were 3.6 FTEs, and it took off, and we grew that to one of the largest academic hospitalist programs. We had 5 campuses, 90 clinicians, and it was great. And so that was kind of the beginning of my journey into entrepreneurship. I really didn't know that I was going to do that until I did it, and then went from there to Team Health and rapidly grew that business to the largest hospitalist program in the United States, and then we're also the largest post-acute program in the United States. So it was a lot of fun. I call it accidental. I didn't set out when I went to medical school to head down this path, but it's been a super fun journey. And I stayed clinical. I drifted off of being just straight clinical to clinical administrative, and then I finally hung it up December of 2019. I was still doing a little bit of clinical work, but it just got too hard. It's just too much time.
Yes, I think either of those jobs are too much work, and then you have like both of them put together. It's going to be a lot of work. Perhaps you did have the entrepreneurship in your DNA, and it's just that the opportunity just knocked on your door and you opened the door. And I'm glad that that accident happened and you are here. Moving from clinical medicine to running companies is a big leap. I'm sure you had some hesitations, you had some doubts. What kept you motivated through the transition? What was that one thing that you thought like, yeah, this is something that I can do and I should do, and this is the way to go for me? What was that?
I think what kept me going, what always keeps me going in this, is I like to solve problems. So I view everything as a challenge. And so, when I was practicing, I was solving problems for my patients and I was, helping them get better. But when I started to think about building and scaling businesses, it was really about what are ways we could be better providers for our patients, better, supporters of our physicians and clinician workforce. And so that was where, like, the constant challenge of it was always the key, which was I'm very competitive. And so when everyone said, you can't do that, or, I've always set big goals, and that's what I've chased after. And so it was just an interesting process over time. And what keeps me going is I love a challenge, very competitive. And interestingly enough, like one of the things that keeps me going the most is having a team. So I really enjoy building a team that we grow with, watching them be successful, watching their careers move forward, seeing them solve problems. And so I have a good time working with the people out there. But definitely the challenges. If someone says, this can't be done, that's usually gives me an idea to go try to do that.
All right. Awesome. Solving the most difficult problems can be a lot of stress for a lot of people, but if you can handle that stress, that's golden. And looks like you actually not just handle it, you enjoy it.
I do. I don't know. Maybe something in my DNA that makes me like the stress more of it. But I think one thing we do in healthcare is overly complicated, right? Yeah. is we try to make it, we try to solve it by making it more complicated. We have to get down to like the just fundamental basics of like, what are the patients looking for? What are the physicians and nurse practitioners and PAs looking for? What are we really trying to work towards? Like what are we really solving for is really the question. And I think there's a lot of people out there, and it's just thinking about the simplest solutions to the problems, right? It's like, I know that sounds really basic, but I think we don't think in advance of like, okay, this is the issue, and really boiling it down to the fundamentals, like value-based care, which I know we'll talk about. We've really struggled with it. We've talked about it for decades, but we haven't really made any progress on it, right? But we haven't solved one of the fundamental issues in healthcare, which is access. So if patients can't get access to healthcare or see their doctor in a timely manner, value-based care will never work. But so people are like, "Oh, value-based care didn't work." I'm like, "But you didn't solve for the basics, which is if a patient can't get in to see their physician or their doctor, they're going to go to the ER and it's not going to work." So I think we have to think about getting back to, before we try to get onto the fancy stuff, which is the fun stuff, which is the basics. Like we could have the best medications on earth. If patients don't take them, they don't work. So we have to think about, I don't know, that may sound really basic, but we really try to think about like the simplest solution that we can kind of move forward, and we start to build those building blocks on it.
The way I see it, what you're telling me is there are already too many moving parts. To solve these moving parts, if you add another moving part, it just gets more complicated. You want to see where we want to go from A to B and go to the basics and moving point.
Patient has an issue. Patient needs to see the doctor. The doctor needs to see the patient. Let's just start there. We can talk all about prior authorizations and eligibility and networks and different payers and employer plans. I mean, we go crazy with acronyms, but fundamentally, patient has a need or concern. Doctor needs to see them because that's what they're there to do. How do we start to get the things out of the way to make that move forward? I could talk about like I was in that generation when we used paper records, wrote in the chart. I used to kid around that the single best thing you could get a young doctor graduating when I was, early on, I'm like, was a pen. Everyone's like, what do you mean? Not a stethoscope? I'm like, no, pen, because we write all the time. Okay. But the EMR has come out, and it's actually, I think, made things worse in many ways because it's not integrated, doctors. Anyway, we could talk all about it, but I think we need to think about what were we trying to solve for, making sure that the technology and all the services like solve for that, and they don't create more. It's very complicated. I mean, I'm a patient as well as a physician, and the system confuses me. Like I get frustrated by it. So I can't even imagine someone that didn't understand like why things are happening and the ability to advocate on that. It's just very difficult.
There might be a little bit of a decision point where you were a physician, you're actually treating patients, and there is some reward in doing so. When you step back from it and get into entrepreneurship, how do you reconcile these two feelings?
Yeah, so people ask me that one a lot. For me, it was remarkably simple. And that really was the idea that if I was seeing a patient, I was affecting one patient and their family, which is great. I mean, I found it very rewarding. But as I was able to build scalable organizations, I was able to affect care for thousands and tens of thousands and hundreds of thousands of patients by providing them with a better experience. And I don't want that to sound like overly lofty, but we need more, I think, clinician leaders, physician leaders that know like, hey, this is the business side, right? Which we have to deal with. But then there's like the clinical side, and how do you marry those two things together? So I always viewed it as, how could I take what was working and how do I make that scalable to reach more people? Because we have, like, I go back to the days, we have a fundamental access problem here in the US. I mean, people just can't get to the care that they need in a timely manner. So that's how I reconcile it. I was able to move the needle for large populations of patients, and that was very rewarding.
That's awesome. You did mention that I'm also a patient. Does that have a role in driving you?
Yeah, it's a huge issue. I'm a patient. My family members have been patients, but I've had to access the healthcare system, and it's awful. I mean, it's fundamentally terrible. It's confusing. It's expensive. You get crazy bills. People call you up and say, this medication you're on, oh no, now you can't take this one. They're changing it. It's brutal. And that's always frustrated me. I am a doctor, right? I know what's kind of going on, but it's anxiety provoking for me. And I can't even imagine what it's like for someone that doesn't really understand the system. Like cardiology is a passion project for mine because I'm a cardiology patient and I've had to access care. And it is stressful for me when I've tried to get an appointment here in the city that I live and someone told me it was 3 months to see the cardiologist. And I knew I was going to be okay and it's like things were fine, but 3 months.
Yeah, it
We
could
wonder
be.
why people go to the ER and because they don't. So it really became about solving that. And then I've also been hit with some of those surprise bills from hospitals that been very upsetting. So yeah, I even back before, my early days of practicing, I always viewed it as if it were me or my family, what would I want? That's the thing that sits in my head all the time. And I'm very honest with our board and our investors and other investors. Is like, you could have if it were you and it was you or your loved one or your mom or your dad or whoever sitting there, what would you want? And how would you want to be treated in that? And how would you want that system to work for you? And we should use that as the North Star that we all work towards. That's what I mean by that complicated. People start talking about all these crazy acronyms. But fundamentally, people need care. How do we figure that out? So
Keep it simple.
It's a lot of what I've tried to do and what I'm trying to do now is to solve for the things that frustrated me as a doctor or the things that frustrated me as a patient.
Wonderful. Coming from both ends. And perhaps the solutions are simple. It's just that we have to identify and recognize it and fix it. But let's get into that as we get into the understanding CardioOne. Can you explain CardioOne in simple terms? What does your company actually do for cardiology practices?
Yes. At its simplest, we are a practice support team that lets cardiologists be cardiologists, and we do all the business. So we like to say, you take care of patients and we'll handle the rest, right? We get back to that. How do we find the simplest problems? Cardiologist needs to see the patients and deal with the patient and their family and their medical issues. The billing, the EMR, the remote monitoring, the marketing, the payroll, the hiring, the HR law, I could go on, right? Contracting, all that is fundamentally a distraction. Physicians don't really get trained in that. So we handle all that. We have an integrated technology solution. We do revenue cycle. We help with support workforce. We help with things like their webpage and, so that people can actually find them. We do all their payer contracting. And it's really to let physicians go back to being physicians and for us to be able to support them. Largely, if you look, especially in cardiology is probably the fastest consolidation of any medical specialty. If you look back 25 years ago, about 15% of cardiologists were employed by somebody. 85% of them were private practice, and you would call up their office and you would get seen. Today, that number is north of 85% of cardiologists are employed. And so that rapid consolidation of cardiologists has led to a lot of infrastructure. It's led to increased costs because those docs are like billing out of hospitals. So our goal is to give those independent docs all the scale and support that one of the employed groups have, while still owning their practice and having it be a small or not so small business, but an individual practice that they make the decisions on what hours they see patients and how long they spend and what type of services they want to provide. So we give them the scale of a large organization without having to sell to a large organization, if that makes sense.
Wonderful. I asked this question during our previous meeting, but the answer for that was you are a cardiologist. And second, there was a high consolidation. And there was also a third reason why you picked cardiology as your focus.
Yes, it's very expensive. And so the fact is that in that consolidation of cardiologists into these big employed models, we are now doing testing and services in these big hospital settings. And that is very expensive. There's these charges, without getting too technical, called hospital outpatient department charges, where the hospital is able to bill substantially more than a traditional outpatient private practice. And that results in pretty significant bills to patients and access problems. So it's driving up the cost of care. And so it was really about I'm a cardiology patient. It consolidated too fast. It's the number one cause of death in the United States. We need to do a better job. And it's gotten more expensive. So we've not bent the curve on things, but the costs have gone up. So it's a prime opportunity to go back to my initial theory, which is we need simple solutions to fix the problem. I went in to try to see a particular cardiologist in a system here where I live. And they sent me a note and said, we wanted to inform you that you would be getting an additional bill to see the doctor. And this is just a regular outpatient visit, like a consult, like you would normally do in an office. And they're like, that usually the charges are somewhere it was like $385. on top of the visit. And that was they were building me a hospital outpatient department. I canceled that appointment because it's ridiculous. Anyway, all those things together are barriers to people getting the care they need, and we need to do a better job. So it's really that constellation was just, when you look at opportunities, like for the competitive person in me, I was like, oh, there's a lot of opportunity here. And more cause of death, consolidated too fast, too expensive. We need to find a better way to do it. That's prime opportunity to try to think differently and work outside the box.
Yeah, and not that this increased cost has improved access. It has actually reduced the access to the patients.
It has, and that's what I think people haven't figured out is that when it's all in these big systems, you call a different number, it's very difficult.
I think one of the solutions that you are proposing is transition from fee-for-service to value-based care. Can you shed a little bit light on both the ideas and how is one better than the other?
Well, so fee-for-service is how the U.S. healthcare system is essentially built today, which you just get paid for every visit, which sounds okay. But I like to use analogies because it helps me put things in perspective. But if you went in and got your car fixed and you got a new transmission and you were without your car for 2 weeks, it was very expensive when you went out, and then you drove it home, and 2 weeks later, the transmission broke again, and you went back and they charged you the same amount of money all over again to fix your transmission, you'd be like, I just paid you. We would never tolerate that. The fee-for-service system in the United States is that you just get paid for every visit, right? So if you go back in, and now there's some new, penalties around readmissions, but it's this whole idea of like, how do we reimburse physicians for the outcome, right? Like, how do we give and reward the medical field, physicians, nurse practitioners, PAs in the system for doing the right things for patients and driving better outcomes? So if you, with your heart failure, never go to the hospital, that's fantastic for you. It's better for the system. But in the fee-for-service world, you actually don't make money because you're not billing on it. So it's really about moving from this whole idea of just paying for every click to trying to reward and reimburse based on the outcome. We know the outcomes we want. We want healthier people. We want lower hospital utilization. We want lower death rates. We want all those things. But how do we move into that? And that transition has been very difficult for our healthcare system as we start to think about doing that. It is it's not a binary. You just don't flip the switch. The system is so built on fee-for-service. So we want to move towards that. In order to be successful in value-based care, I'll go back to my earlier point. If patients can't get in to see you, where are they going to go? They're going to go to the ER. So if you don't solve for the basics, you will never be able to move into value-based care. And so, but if you solve for the basics where you have better access and patients can get in regularly and quickly, you actually will make more money in fee-for-service because more people will come to see you. So it's this really great way of looking at it. So I use the term, we solve for today and build for tomorrow. If we're solving for things like access, if we're solving for things like lower site cost of care, doing things in the ambulatory world instead of the hospital, if we solve for things like remote monitoring and virtual care with patients at home, those are revenue generating in today's fee-for-service world. But they are absolutely critical if you're going to move into this kind of outcomes-driven thing. So we like to use the term, we solve for today, build for tomorrow, because that transition from our current fee-for-service world is going to be very slow. So it's going to be 95% fee-for-service, 5% value-based care, 90%, 10%. It's going to move very slowly. It will never be a massive switch. So I think our goal is to try to help doctors and help our practices solve for all the challenges of today. But in doing so, they're prepared and ready for someone to come to them and say, hey, we're gonna have you take risk on your heart failure readmissions. Basically, that transmission that you fixed is going to stay fixed and not go right back in. And so that's kind of how we think about it.
If you don't mind, can I ask a little bit
Oh, yeah, please.
deeper question on this value-based care? So a lot of patients, and especially in cardiology, I think this is something that from a pharmaceutical perspective, we do face for adherence, for preventative care. And a lot of for example, PCSK9, it is a preventative care for an event. So how do we design a value-based care for some event that you have prevented, because there is no criteria or a metric that we predict that it is going to happen, but it's an event that is not happening. So how do we bring out a value-based care metric for, I would imagine, a significant number of patients in a practice?
Yeah, you hit the $1 million question, right? How do we move from sick care to healthcare, right? Right now, let's face it, most people don't go to the doctor unless something's wrong. we need to be getting in front of those things because all disease progression is a linear process, right? So you don't suddenly develop coronary disease and have a heart attack overnight. It's been building. Your cholesterol's been too high, your weight's been too high, your blood pressure's not controlled. We need to figure out how to get earlier intervention. So we need to get the mindset of people to switch. But again, like, am I going to go back to my access thing? So if you're seeing your primary care doctor and you're like, you know what, I'm worried about my cholesterol and my dad had a heart attack when he was in his 50s. Well, if it takes you 3 or 4 months to get in and there's no access, it's hard to do. So I think we have to think about, one, educating the population around what people should be asking their doctors. And I mean, Dr. Google can be frustrating, but people should be looking and people should come with questions around, hey, what about this? And then we have to start thinking about how to make that model about healthcare, not sick care. And that's a fundamental. I don't have. If I had the answer for that, I'd be very wealthy and retired, and I'd have fixed all of U.S. healthcare. But we have to start thinking about, like, what are those ways of treating people? There's a great book if you get to read it. I have no interest in it, but Peter Attia wrote a great book called Outlive. And he has some phenomenal examples in there that I think really resonated around just thinking about, like, diabetes. Like, one day, your blood sugar hits a certain level and you're like, oh, you have diabetes. Now do all these other things. Well, when it was 2 points below that, like, were you zero risk? No, it's all tied together. And so how do we get people invested in the wellness side of it? Right. And, you know, I think the payer models struggle with that, right? Like, making those investments early around, I think you mentioned PCSK9 inhibitors. I mean, they're phenomenal. I take one. Unbelievable. Hugely expensive. And it took a lot of work for my doctors to get my insurance company to put me on one. Because they were like, well, you're not having chest pain. I'm like, I don't want chest pain. I'm trying to avoid that. And so I think it's trying to think our way around that. You know, some of the early processes with Medicare Advantage were trying to do that, you know, managing the whole health of the patient and being able to provide services outside of just like sick care, like nutrition and exercise. And, you know, they're great. They're really phenomenal Medicare Advantage plans. They'll like drive you to the appointment. So yeah, it's an interesting conversation. I think we need to talk about it more. People don't like to talk about healthcare.
And especially underlying conditions like you did mention diabetes, and pre-diabetic condition is so easy to catch if you just get tested.
I'm on a personal mission, and I put a lot on social media trying to educate people around, now I'm going to get very technical, but around lipoprotein little a, which is many people, like I have friends who are like, my cholesterol's fine. I'm like, they didn't test it. I have terrible LP little a. And if a doctor 10 years ago, before I, as a doctor, even knew what it was, hadn't tested mine, I'd be in a much different place. So, but again, it's to that point of like, these are things we need to manage. And, you know, we have to kind of get people thinking about going and like, you know, getting their screening and thinking about it and talking about it more. And I think we're starting to move in that direction as a country. But again, I'm going to go back to the other issue. If it's inaccessible and it's too expensive, no one's going to use it. So if you call up and be like, I'm going to go and get my blood sugar and my cholesterol checked, and I'm going to, you know, see the cardiologist because my family history, and I'm going to make sure everything's good to go. And then you call up and they're like, well, wait here and we'll get a prior authorization. 3 months later the appointment you scheduled, all of a sudden you have a work obligation come up and you have to reschedule it. And it's 3 more months.
A month. Yeah.
Before you can get back in. You're never going to solve that. So I think it gets back. I mean, it really does fundamentally get to that. We need to make it accessible, not a challenge.
And between those 3 months, I'm sure there are many events that have happened that could have been avoided.
Yeah, I mean, if it's that hard to get in, I have this happen all the time because I travel like every week. Where I'm like, oh no, I can't make that meeting. I can't fly that day because I have a doctor's appointment, and if I have to reschedule, it's going to take me months to get back in. So, it is interesting. You know, I think that there's more. We need to think about disease processes as linear. Coronary disease, heart failure, it starts somewhere long before you ever know you have it. And so one of the things we're trying to advocate for is, you know, earlier access to a cardiologist, right? Many people don't see a cardiologist until they've had a heart attack and then they're in the ER, or they're in atrial fibrillation, or they're in heart failure, right? They just haven't done it. But I think if we can solve for those issues, it's really important. We just, again, I'm going back to it. We need to make it easier for patients to get seen and doctors to see patients.
Yep. It's a compounded question. My next question, the big win for CardioOne that is close to your heart and the challenges that CardioOne has. The challenges could be your business challenge or it could be pushback from practitioners, whatever the challenge that comes to your mind, the win and the challenge.
Biggest win was we unemployed our first big group of cardiologists. So there's a group in Manchester, New Hampshire, cardiovascular specialists of New England, and they were employed by a big hospital in the area, and they were, frustrated, like many employed doctors are right now, and they wanted to branch out on their own and have their own practice and decide how they wanted to work and figure out what tests they wanted to do and have their own built, like just have the practice like people thought about a long time ago. And they called us up and I flew up and I met with them and I'm kind of sarcastic. We liberated that group of docs in September and they're unbelievably successful from their patient access to the testing. They're a phenomenal group of docs. And every day that I talk to them, and it's not always smooth sailing, like there's bumps, right? But we fix things like things, billing, things change. It's the most rewarding thing to see that group like truly own their business again, invested in it, thinking about it, watching it grow. And we're partnering with them and just continuing to evolve that. It is fascinating to do. I'm super proud of them for having the guts to do what people don't do, which is to go the other way. Really appreciative of them trusting us to be their partners on this. And it's a phenomenal opportunity. We're doing our next one in Seattle in June. So I'm flying up there in 2 weeks and they'll be going out on their own, building their own office. It's fun to go. Like it's exciting. We go there, we talk about picking out furniture and getting the office decorated. It's just fun stuff to do. Biggest challenge. We're fighting a healthcare system that is so focused on massive consolidation by hospitals and health systems that it's a challenge. We are a small group of independent docs going up against big health systems. Look around every market where you live. Huge health systems, they're everywhere. They buy every hospital, they buy every doctor. You just can't work. And that is the challenge. I know we're doing the right thing, but we need to get more traction with government and regulatory environment to make sure that they know that we have a lot of opportunity here. So my biggest win is I call them the CISNY group, the New Hampshire Docs We Liberated. Challenge every day is that the healthcare system has gotten so big. Almost all the top 10, 80% of them are not-for-profits. And they're so big and they have so much dollars consolidated that it is hard to go against them. They kind of control the pricing in the market and everything. But back to your first question, what gets me going? I'm hugely competitive in a challenge. The mere fact that we can go the other way is I get more excited about it every day we work. And our whole team they fundamentally love what they do because we're seeing the ability to kind of watch the doctors, be able to be doctors, see the patients get access. And it's fun kind of being the one doing what everybody else isn't doing. But I think that's going to change. I'm confident that there's other people out there that are going to say, you know what, we need to move back from this kind of massive, kind of consolidated view of healthcare and get back to smaller, more intimate engagements, physicians really being a part of it. Now, this is kind of funny. Less administrators. Technically I'm an administrator, right? More people providing care. We spend a lot of dollars and a lot of people on things that don't fundamentally impact the patient and the doctor and their outcome.
Are you a fan of Game of Thrones? Have you seen the scene when you spoke about the whole thing that you are standing there and going against a big force, and then you're hoping that the other people will come to support eventually, and they will recognize that you need it. It's that scene when Jon Snow is standing against Bolton's army, right, in the Battle of Bastards.
Yeah, there is yes, we are, but I stand with a bunch of great colleagues. So I'm part of this is off the tech side. I'm part of this group called the American Independent Medical Practice Association. We call it AMPA for short. And it's an advocacy group that formed not even 2 years ago. Every day that I interact with that, I sit on the board there, I represent all the CardioOne docs on it. And we represent 17 specialties, physicians from pretty much every state in the union, all independent like us. And we go to Washington, we lobby, we do research on costs of independent docs versus health systems, trying to educate the government and the regulatory environment, patience around how this all comes together. So it's fun to go. I love when I get together with my AMPA colleagues because we're all wired the same. We're all passionate about this. We're all like, we're going to beat this thing. So I put a little plug in for them. They've been a phenomenal group in terms of helping move the cause for independent docs, which I think we need to do.
They are all swimming upstream together.
Yes, we are.
Wonderful. Looking ahead as a thought leader, what do you think independent practices should do? That one critical thing that they should do to compete with the large health system?
Find the right partner to work with. It's the challenge in general is you can't do it on your own. And what happened was I think docs saw how difficult it was. And so I don't want to say the easy out, but like these health systems were like, hey, we'll give you money, we'll take you. And so we doctors across all specialties, but cardiology has really moved very quickly. We ran right into the health system. And we, in an effort to solve for the difficult parts and in return for more security and guarantees, we sacrificed a lot of our independence to the health systems. Now, I'm not saying health systems are bad. They clearly serve a very valuable purpose. But we have, I think, just like the pendulum moves back and forth, I think we swung way too hard that way. So I think independent docs should know that they're not alone. There are options out there, and finding the right partner that will allow them to move, like to be the doctor that they went to. Like we all went to medical school. We went to school for a long time to become doctors. Like that lets them be the doctor that they want to do. And I'm seeing more and more interest in this movement towards independence and more physician autonomy and more physicians taking leadership roles. That I'm very optimistic about where things go. Healthcare in the U.S. is a huge problem, right? I mean, access. Let's just talk about the cost. It's awful. It's unsustainable. We, the physician leaders and the people doing the work, have to be the one to find a solution for it. And so I think there's a great bright future ahead for all docs, independent, employed, but we need to figure out how to solve those problems in a simple way to get back to patient got a need. We need to see the patient and focusing on that, and then like figuring out how to like get rid of all the noise in the system.
Wonderful. This is coming from your perspective, you being an entrepreneur who has been a physician. What would be the advice for physicians who want to become entrepreneurs? Is there something that you want to tell the physicians?
Yeah, I get this question a lot. I ask people, why do they want to do it? So I'm like, why do you want to be an entrepreneur? Why do you want to be a physician leader, up at the tippy spear, pushing on things? You have to fundamentally ask yourself why you want to do it, what motivates you, and like, is it the right fit for you? There's a lot of people that say, I want to go do that. And then I'm like, well, you're going to be on an airplane flying. People are like, well, I don't want to be on it. Like, you fundamentally have to ask yourself what drives you. I like to kid around with some of my friends, and people have asked me, they're like, well, I want to work less and make more money. I'm like, okay, you chose the wrong thing. Because you're probably going to work more and make less money, especially as an entrepreneur, because you're building from the ground up. So people I think people have to ask themselves, like, why do they want to do it? And know their personalities. If you have to be a bit of a risk taker, and you got to be able to stick your neck out there and be confident, and you got to be able to handle criticism. People, if you're doing things that are new and you're starting off, people are going to say you can't do that, right? Like, who knew Jeff Bezos was, when he started selling books in his garage, was going to be the person that determines every single thing I buy in my house, right? And when he went from books to making sure we had paper towels delivered, people were like, I don't really get that. Or, making Prime Video, right? Like, I watch that all the time. So, like, you think about that, it's the people that push the limits of it that are the ones that have been really successful. And yeah, I think I have to ask people that. And you have to be willing to look at what you have and say, is this really good? And is this innovative? And even if you built it and you loved it and it's not working, you have to look at it every single time. I'm dating myself. So I grew up on the BlackBerry.
Okay.
So everybody had a freaking BlackBerry, right? The guy that ran BlackBerry was like, no one will give up the keyboard. Gone. Obliterated. Right? Should have looked and said, I'm addicted to the keyboard, but is that really what everybody needs? Like, so I ask people that all the time, like, you have to look at what you're doing and be like, I kid with my team. Sometimes we'll do something. I'm like, why are we doing that? That's a terrible idea. And they'll be like, that was your idea. I'm like, well, it's a terrible idea. Let's change it. So fundamentally ask, why do you want to do it? And then do you have that personality type that can take risk, tolerate criticism? And you have to be your own biggest critic. Because if you think that someone else is not looking at you, you're mistaken. So I ask people that, like, You get a good job, rewarding career. Why? And that's just a wiring thing. So I think people have to figure that out for themselves. But it really comes down to those, like, are you like really like critical of what, because you're going to look at a problem and the entrepreneurs come up with solutions for problems. And like people like Apple come up with problems that we didn't even know we had so they could make the solution. And I've got like more Apple devices. I didn't know I needed like an iPad and an iPhone and an iWatch and all this and like Apple, like all this stuff. But sure enough, now we got to have it. So anyway, I could talk all about like kind of entrepreneurship and what drives people, but all the big cases of people that have really just blown it out or have all done things that people are like, the iPod, like, I grew up on Walkmans, right? Sony Walkman, like everybody had a, and then like Steve Jobs came around and be like, hey, we're going to put your music in this little thing and we're going to download it all. And they're like,
1,000 songs.
Sure. And now they're all gone, right? So anyway, I think we don't have it, that I think in healthcare in general, and healthcare management and healthcare operations, there's innovation is, I don't want to say non-existent because that's overly harsh, but we don't innovate. We don't innovate like tech companies and manufacturing and people that have to constantly push the absolute limits of it. We're still tinkering around. Like, I'll use the EMR example. They don't talk to each other. The people are like, oh, they're interoperable. I'm like, no, they don't. I have 4 Epic logins in Denver. 4. Wow. And so I went to another doctor. I'm like, oh my God, they're in the Advent Epic. They're all different. And do you know that when I go, even though I've reconciled my meds and all my diagnoses in the 2 other ones, they literally sat me down and they're like, what about this stuff? I'm like, I haven't been on that it was like prednisone I got like 4 years ago. It's the same thing. If Apple, like you can take your iPhone, right, and throw it in the toilet, go get a new one, log in, all of it comes right back. But God forbid you go to an Epic hospital and go to another Epic hospital, they don't talk. So anyway, like we could talk at length about this because it makes me crazy. But like if you think about like we just haven't innovated, and I think we've got some really cool clinical interventions, right? People do aortic valve replacements through a catheter without cutting you open at all. That's insane. That's like fixing through the muffler where they don't open the hood.
Yeah, like, and when the car is running.
Yeah, you're like, how do we? But then no one can figure out that my medication list just follows me to each EMR. Think about that. I mean, from a tech standpoint, we could probably go to a bunch of college kids at MIT or any other college out there and say, hey, can you make all this follow you around? Oh yeah. I mean, my music syncs on all my Spotify. My medications cannot move from one Epic EMR to another. People have to stop and ask themselves, we've poured hundreds of billions of dollars into that system. Done really? Anyway, so you can see I got all spun up on it. But I look at those things and you're like, okay, we've solved for that. We've solved for that.
We have the solutions. We were 100%. And
I go to Whole Foods and then what I ordered, it shows up on my account. Like I can actually look at the groceries that I bought. Because one day, I forgot something. I'm like, oh, I must have left it. But I never paid for it. I looked online, it was there. So if they can sync my groceries from the scanner at a Whole Foods into my computer, how come my medications can't follow me? Or my diagnoses? Or the CAT scan that I had that's a digital file, I have to get it on a CD. Remember those? I mean, like, think about that. Or my favorite one is, my wife had this the other day. She needed a test done. And by the way, we actually are healthy people, but we're trying to stay healthy. So she needed to have something done. So the doctor printed out a prescription for her, and they were like, can you fax it to us? And she was like, we don't have a fax machine in our house. Can I email it? No, we still operate on fax machines. So anyway, we talk about the tech dilemma thing in healthcare. Think about that. Yeah. Like people still use pagers. It's crazy.
And I don't even know if there is a system for pagers anymore, but
people are like, I'll have to get you the CD. Like if someone sent me a CD, I don't have anything, like I'd have to go buy it. But if it's just interesting, I create my own digital health record. I tell all my friends to do the same thing. Right. Everything I get.
But you can do it because you know what to do.
Yeah.
You know what to do and you know what is critical and how to read it. That's like 0.1% of the population.
Yeah,
What of the rest? Yeah, what of the rest? And I find that fascinating. I think the healthcare system has to move slowly just because of the HIPAA and GDPR regulations, right?
Yeah, there's more right.
I think it has to move slow, but not this slow. this slow is just not excusable. Yeah. And we know these problems have been solved. Like if you go to a country like UAE, the whole system is connected. You can go to any hospital and I believe that is connected, like the whole country is connected.
Actually, the one that people make fun of is the VA is probably the most connected one out there because it's all...
But you have to learn DOS there sometimes, I think.
Yes, you do.
All right. And before we wrap up, a few 90 seconds, if you want to take this, you can take open question. You want to reiterate something or something we missed, it's your time.
I think people, one, I want patients and everybody listening, whether they're a patient or a physician, take control of your healthcare. That's all on us. Think about healthcare, not sick care. And then for everybody in healthcare, I think we need to think back to the simples, like the simplicity of it. Like, what are the problems we're trying to solve for, and find simple solutions to those. And then we make the rest of it follow along. A tech solution or regulation should be there to solve something. We shouldn't be trying to take a tech solution and then go find the problem to solve with it. That's really been key. And then finally, I'm doing 3, but I'll be fast, is I think we need to continue this whole idea of independence. And I think this idea of, physicians being back, controlling their practices, working with their patients is something we need to just see more of. And for those patients out there, go look for your independent docs. They're out there. Hard to find, but very worth it when you find them. And I really appreciate the time and the opportunity to chat. Lots of passion projects for me and around healthcare and technology. And I think we just looking forward to us as an industry thinking about getting those problems solved and kind of just getting back to what we all went to training to do.
Wonderful. Without this passion, I think as humanity will not move forward towards the right direction. So I'm glad you are there with all the passion. And I appreciate your time, Jasen, and it was a wonderful conversation. I learned a lot today.
Thank you so much. Have a great day. Appreciate it.